It used to be that growing old meant slowing down, spending time with family, and enjoying the fruits of your labor. But today, it's starting to feel like a luxury only the wealthy can afford. From skyrocketing healthcare costs to the price of simply having someone help you get dressed, growing old is becoming too expensive. And the real cost? It's not just money. It's dignity, independence, and peace of mind. Aging was once seen as a well-earned season of rest, a time to reflect, reconnect, and finally enjoy life at a slower pace. But for millions of older adults and their families, that vision is slipping further out of reach. Instead, growing old has become a financial tightrope. The rising cost of prescription medications, home care, assisted living, insurance premiums, and long-term medical treatment has created a burden that many can't carry alone. For some, the choice comes down to paying for care or groceries. And the impact goes beyond budgets. It's affecting people's quality of life, their ability to stay independent, and their sense of control in the years that should feel the most secure. In this video, we're going to break down exactly why aging has become so costly. From the hidden expenses to the systemic issues driving the crisis. We'll also explore how families are coping, what resources exist, and what changes need to happen to restore dignity to the aging process. Because no one should have to go broke just to grow old. It's no secret that healthcare is expensive, but for older adults, it can become a full-blown financial crisis. Many seniors live on fixed incomes, counting every dollar of their retirement or Social Security. But those dollars are being stretched thinner each year by the rising cost of medical care. Even with Medicare, out-of-pocket expenses for things like prescriptions, procedures, and premiums add up fast. And here's the harsh reality. Medicare doesn't cover everything. In fact, it leaves out some of the most essential services for older adults: dental care, vision, and long-term care. Need a new set of dentures? That's on you. Glasses or cataract surgery? You'll likely pay a significant portion out of pocket. And if you need help at home or require time in a nursing facility, Medicare often covers a limited window. After that, the burden shifts to families or personal savings, if any remain. According to a report from Fidelity, the average retired couple will need around $315,000, 0 cents, just to cover healthcare expenses throughout retirement. And that doesn't even include long-term care. That's not luxury care. That's just staying afloat. The result? Far too many seniors are skipping the care they need. They put off doctor visits, they split pills to make them last longer, they endure pain because they can't afford physical therapy. Some avoid getting treated at all, worried that a single ER visit could wipe out their savings. One woman told me she stopped getting eye exams because her Medicare plan didn't cover vision. Another admitted he gave up a medication his doctor prescribed because the copay alone was over $200, 0 cents a month. And it's not just the uninsured who are struggling. Many with supplemental plans still face high deductibles and coverage gaps they didn't expect. It shouldn't be like this. Aging shouldn't come with the fear of bankruptcy for needing basic care. Healthcare has become a puzzle older adults are forced to solve without the full picture and without the resources to keep up. It forces impossible decisions and sacrifices, all at the expense of health, independence, and peace of mind. And while we can't change the entire system overnight, we can start by talking about it, by calling out the gaps, the hidden costs, and the real stories behind the numbers. Because the truth is, it's not just the body that suffers when healthcare becomes unaffordable. It's trust, it's freedom, it's the quiet hope that growing older will feel safe. And if rising healthcare costs weren't enough, there's another expense that sneaks up on many families: long-term care. Whether it's hiring someone to help with daily tasks at home or moving into an assisted living facility, the price of simply getting the care you need each day can be staggering. Right now, the national average cost for a home health aide is over $5,000, 0 cents a month. Assisted living, around $4,500, 0 cents per month, depending on your state. And nursing homes, especially those with full-time medical care, can cost anywhere from $90,000, 0 cents, to over $120,000, 0 cents per year. These numbers aren't for luxury suites or high-end packages. they're for standard care. What makes this harder is how quickly it becomes necessary. A fall, a stroke, a slow but steady decline in mobility. Suddenly, aging in place safely isn't possible without help, and that help comes with a high price tag. And even if you can afford it, availability is shrinking. Waitlists for good assisted living communities are growing. Many seniors are left with few choices, either stay in unsafe situations or move far from home to find somewhere affordable. I spoke with a woman named Ruth, 83, who lived her entire life in the same town. When her arthritis worsened and she needed daily help, the only assisted living option within budget was 3 hours away. She cried when she packed up her books, left her church community, and said goodbye to her neighbors. "I never thought I'd have to leave my home to afford help," she told me. "It feels like I'm starting over at the end of my life." And that's the emotional toll we don't talk about enough. The financial burden is immense, but so is the heartbreak. Downsizing from a house full of memories, leaving a community you spent decades building, being separated from children and grandchildren simply because of cost. And just like with healthcare, Medicare doesn't cover most long-term care. Unless it's short-term rehab after a hospital stay, you're expected to pay out of pocket or spend down your assets to qualify for Medicaid, often leaving families financially drained. The system wasn't built for the reality we're living in. People are living longer, yes, but they're also aging with more complex needs. And the support, it isn't keeping up. So what happens next? Too many seniors are delaying the care they need. Others are making impossible choices between independence and affordability. And families, many already overwhelmed, are stepping in to fill the gaps, often at great personal and financial cost. This isn't just an economic issue, it's a moral one. Because no one should have to choose between safety and staying near the people they love. When care becomes too expensive and support too limited, the responsibility doesn't disappear, it just shifts. And more often than not, it lands squarely on the shoulders of family. Adult children, many of whom are already raising kids or managing full-time jobs, are stepping into the role of caregivers, financial planners, and healthcare advocates for their aging parents. It's not that they don't want to help, it's that the system leaves them with no other choice. But that choice comes with a cost. Some move their parents into their homes, creating multi-generational households that can feel crowded, chaotic, and emotionally strained. Others dip into savings or take out loans to cover prescriptions, medical bills, or assisted living deposits. Many cut back on work hours or leave jobs entirely to care for aging loved ones, losing income, retirement benefits, and sometimes their own health in the process. And the emotional toll is just as steep as the financial one. Caregiver burnout is real. The constant juggling of roles, parent, spouse, employee, child, can leave people feeling exhausted, guilty, and isolated. They want to be there, they want to do it right, but there's only so much of them to go around. Meanwhile, some older adults, those without family or unwilling to burden the ones they have, are quietly returning to work. You've seen them. The 72-year-old at the grocery checkout, the older man greeting at the front of the store, the woman behind the pharmacy counter, who should be enjoying a peaceful retirement, but is instead standing on tired feet just to make ends meet. According to recent data, nearly 1 in 5 adults over 65 is still working, many because they have to, not because they want to. They're not funding luxury lifestyles, they're covering rent, medical bills, groceries. They're filling the gap left by pensions that never came, savings that ran out, and systems that were supposed to catch them but didn't. And the cycle continued. Families trying to do the right thing, seniors trying to maintain independence, all while navigating a society that's made aging one of the most expensive seasons of life. It wasn't always this way. There was a time when aging was a shared responsibility, where communities stepped in and systems supported those who had spent their lives contributing. Now, it often feels like everyone's doing it alone, quietly and with increasing strain. If you're wondering why all of this feels harder than it used to, why so many seniors and families are struggling just to stay afloat, it's not your imagination. The cost of growing old isn't just high, it's getting higher. Inflation is hitting everyone, but it hits the elderly especially hard. Prices for basics, groceries, rent, utilities, transportation have climbed faster than most retirement incomes. Fixed pensions and Social Security checks don't stretch like they used to. And for older adults already on a tight budget, that gap can quickly become dangerous. One month, it's just cutting back on brand-name groceries. The next, it's skipping a meal to afford medication. Before long, the question isn't what to sacrifice, it's what's left to give up. And while living costs rise, the support systems that were meant to help have failed to keep up. Social safety nets like Medicaid, food assistance, housing programs, and community-based elder services are often underfunded, under-resourced, and overwhelmed. Wait lists stretch for months, caseworkers are overburdened, and too many fall through the cracks. It's not that people don't want help, it's that they've been told it's there, then find it's not enough when they finally need it most. And layered over all of this is a system where elder care has become a booming business, not a public service. The long-term care industry, worth hundreds of billions of dollars, is increasingly controlled by private equity firms and for-profit chains. That means facilities are often run with profit margins in mind, not people. Staff are underpaid, corners are cut, quality suffers. You hear the stories. Residents left unattended, meals rushed, care plans ignored, not because the caregivers don't care, but because they're stretched too thin under the pressure of corporate targets and cost controls. And families? They're paying thousands a month for peace of mind, only to live in fear that their loved one isn't getting the care they deserve. This system wasn't built for compassion, it was built for efficiency, but growing old isn't efficient. It's human. It requires time, dignity, and real investment. And right now, too many people are being priced out of the very support they need to survive. The truth is, the crisis around elder care isn't just personal, it's structural. It's about policies, profit models, and a society that hasn't prepared for what happens when millions of people grow old at the same time. Behind every statistic, behind every dollar figure and policy failure is a person, a mother, a grandfather, a neighbor. And while the financial toll of aging is heavy, the human cost can be even more devastating. Because when the ability to afford care becomes the deciding factor in what kind of life someone can live, it's not just money that's lost, it's independence, it's dignity. You see it in the way people start to shrink into themselves, when they stop asking for help because they're afraid it will cost too much, when they skip outings or stop attending social groups because they can't afford the gas, the bus fare, or the program fee. They don't want to be a burden. They don't want to seem needy, so they go without. And slowly, the world begins to close in. There's a deep emotional cost to aging in a system that feels like it's always just out of reach. It's the quiet shame of needing help getting dressed but not being able to afford a home aide. The guilt of relying on children who are already stretched thin. The sorrow of selling a home not because you want to, but because you have to. Many older adults, once vibrant and engaged, begin to feel like shadows. They watch life continue around them, but they feel left behind, cut off by cost, by distance, by decisions they never thought they'd have to make. And that sense of being a burden, it weighs heavily. Even the most loving families can't always ease the feeling that you're too much, that your needs are inconvenient, or that your very survival now depends on someone else's sacrifice. It chips away at identity. It turns once independent people into reluctant dependents, grateful but grieving. And isolation only deepens the pain. Without affordable transportation or access to community programs, seniors are often confined to their homes. A doctor's appointment becomes a major ordeal. A trip to the grocery store requires careful planning or someone else's help. Social interaction becomes rare, and loneliness sets in. Quietly at first, then persistently. This isn't just about quality of life. It's about being seen, being valued, and having the freedom to move through the world on your own terms. When cost dictates care, it's not just healthcare we're rationing. It's human connection. It's emotional well-being. It's the simple joy of belonging. And for too many, that loss is the most painful cost of all. With all we've talked about, the rising costs, the broken systems, the human toll, it's easy to feel overwhelmed. But this story doesn't end in despair, because even though the challenges are big, change is still possible, and it starts with small steps. Families can begin by having the conversations we often avoid. Talk about future care before it becomes urgent. Discuss living preferences, finances, and long-term plans early, when there's still room to prepare. It's not always comfortable, but planning ahead can prevent heartbreak later. Financial literacy also matters more than ever. Understanding how Medicare works, what it doesn't cover, how supplemental insurance might help, and what local benefits are available, it can make a real difference. Many communities offer free financial planning workshops for seniors or caregiver support groups that connect people with local resources they didn't know existed. Look into programs through local senior centers, nonprofits, or aging commissions. Some offer transportation assistance, low-cost meals, or home care services. These supports may not fix everything, but they help ease the load. But real, lasting change has to go beyond the individual. We need systemic reform. Policies that prioritize affordable elder care, strengthen safety nets, and treat aging as a public health issue, not a private burden. That means advocating for better Medicare coverage, especially for dental, vision, and long-term care. It means pushing for higher wages and better training for caregivers. It means funding community-based alternatives that help people age in place with dignity and support. And it's already happening in some places. In New York, a program called Naturally Occurring Retirement Communities, or NORCs, is providing support services directly in senior apartment buildings, things like social workers, health screenings, and group events. It's helped thousands of older adults remain independent, connected, and cared for without needing to move into expensive facilities. These kinds of community-based models show that it is possible to age affordably with dignity when the right support structures are in place. Because aging shouldn't be a crisis to manage, it should be a stage of life we honor, protect, and prepare for. It's going to take effort. It will take awareness. But we can start where we are by listening, planning, showing up for each other, and raising our voices when something doesn't feel fair. Because no one should have to go broke or feel broken just to grow old. After everything we've walked through, the costs, the caregiving, the systems that fail, and the families trying to do it all, there's one truth that rises above it all. Growing old should be about peace, not panic. It should be a time of rest, reflection, and reconnection. A time when people are surrounded by care, not consumed by costs. A time when the wisdom gathered over decades is honored, not sidelined. And yet, for too many, aging has become a crisis to survive instead of a chapter to embrace. We've allowed a basic human experience to become a commodity, where care is sold at a premium and dignity too often comes with a price tag. But aging is not a business model. It's not a profit center. It's a shared reality we will all, if we're lucky, move through one day. It's time we start treating it that way. We must protect and respect aging, not as something to fear, but as something to support, with policies that care, with systems that lift, with families and communities that don't just manage aging, but honor it. Because the true cost of growing old shouldn't be measured in dollars, in insurance copays, or monthly bills. It should be measured in something deeper, the respect and care we offer those who paved the way for us. The quiet strength of our elders built the world we now live in. They taught us, raised us, protected us. The least we can do is ensure their final chapter is one of comfort, not compromise. Let that be our standard, not survival, but dignity. And let this conversation be just the beginning. Thank you for being here. If this message spoke to you, please share it, subscribe, and keep the conversation going, because together we can rewrite what it means to grow old in this world with honesty, humanity, and heart. If this message moved you or reminded you of someone you love, I hope you'll share it. These stories, our stories, deserve to be heard. And if you're walking this path yourself, whether as a senior, a caregiver, or someone trying to make sense of what aging means today, know this: you're not alone. Subscribe to Elderly Truths for more honest conversations, heartfelt reflections, and practical insights on growing older with grace, dignity, and strength. And until next time, take care of yourself, take care of those who came before you, and never forget, aging is not a problem to solve. It's a journey to be respected.